The Centers for Disease Control and Prevention, CDC, is a cornerstone of American public health, and one of its most influential, though often unseen, instruments is the Vaccine Advisory Panel, officially known as the Advisory Committee on Immunization Practices, ACIP. This independent group of experts helps determine how vaccines are used in the United States. Their decisions affect children's doctor visits, adult immunization requirements, pandemic response plans, and even what your local pharmacy stocks. Members of the ACIP are not employed by the CDC. Instead, they are appointed through a formal selection process that includes specialists in fields such as immunology, epidemiology, internal medicine, pediatrics, and public health. These individuals bring a scientific, data-driven perspective to the complicated and often controversial world of vaccination policy. Their recommendations are not made lightly. They review clinical trials, population health data, safety concerns, and economic factors before issuing any guidance. The ACIP has the authority to recommend the addition or removal of vaccines to the U.S. immunization schedule. They determine which vaccines should be given to children and adults and at what intervals. Their influence is vast, reaching schools, military health systems, hospitals, insurance companies, and international health agencies. Recommendations made by the ACIP are submitted to the CDC director and, upon approval, become official CDC policy. Although the panel is advisory in nature, its guidance is treated with enormous weight throughout the medical and scientific communities. One of the ACIP's most significant roles is during public health emergencies. In times of crisis, such as the COVID-19 pandemic, the committee can hold emergency meetings and issue urgent recommendations on how limited vaccine supplies should be prioritized. Their decisions during COVID shaped the order in which healthcare workers, elderly individuals, and high-risk populations received vaccinations. Even with political pressures and public scrutiny, the committee adhered closely to the available scientific evidence to make life-or-death decisions under immense stress. The panel has contributed to some of the most successful public health achievements in modern history. Thanks to their guidance, diseases like polio, rubella, and measles have been nearly eliminated in the United States. Their early support of the HPV vaccine will likely save thousands of lives by dramatically reducing rates of cervical and other related cancers in future generations. Their continued support of seasonal flu vaccines and emerging vaccines against RSV and shingles demonstrates a proactive approach to population health. However, the panel's actions have not been without controversy. At times, critics have accused the ACIP of being too slow to update recommendations or of hesitating to approve widely expected guidelines. During the early stages of the COVID-19 booster rollout, confusion arose over who should be eligible and when, leading to mixed messaging that hurt public trust. While members are required to disclose conflicts of interest and recuse themselves from related decisions, allegations, whether founded or not, about ties to pharmaceutical companies have added to public skepticism in some circles. In an era where vaccine misinformation spreads rapidly, the panel's communication strategy has not always been as clear or aggressive as it perhaps should have been. Still, the absence of the ACIP would create a vacuum that could have dangerous consequences. Without an independent vaccine advisory panel, the CDC would either be left to make immunization decisions internally, subjecting them to more direct political influence, or be forced to rely on ad hoc committees lacking long-term cohesion and structure. State and local health departments might begin issuing their own conflicting guidance. A loss of national standardization would result in confusion, weakened immunization coverage, and even greater mistrust of public health institutions. Schools, clinics, and physicians would have no clear roadmap. In short, the CDC without an advisory panel would be far less prepared to meet both routine health needs and future public health emergencies. Despite moments of misstep and critique, the Vaccine Advisory Panel stands as a critical firewall between scientific truth and political spin. Its mission, rooted in public service and evidence-based reasoning, protects the health of millions. As debates around vaccines continue in an age of skepticism and social media noise, the panel's presence ensures that medical decisions remain guided by data, not headlines.